Good afternoon, you're watching Sky News. The latest NHS figures are out and they make for pretty worrying reading. The government has admitted the health service will miss its A&E targets for at least another year. When in a letter to Trust, the head of the NHS in England has warned targets must be met by March 2018. Well, let's take a look at some of them in a bit more detail. And once again, key targets for A&E and on ambulance response times missed in January. In fact, they haven't been hit for almost 2 years now. Patients in A&E should be admitted or discharged within 4 hours in 95% of cases. But in January, that happened only 85% of the time. And the figures show nearly 1,000 patients had to wait more than 12 hours. That's compared to just 158 in January 2015. Now, ambulances should reach patients with life-threatening conditions within 8 minutes in 3/4 of cases in January. That happened just 2/3 of the time. And if a GP suspects you might have cancer, you should start treatment within 62 days, and that's in 85% of cases. However, 79.7% is the lowest on record. Well, speaking earlier today, the Health Secretary, Jeremy Hunt, said the government remains committed to the A&E target.
It's not going to be overnight, but it is essential, and I am expecting the NHS to return to that target during the course of the next calendar year and make very tangible progress towards that target during this year. Some of the tools now have been put in place, but also it's going to take a huge focus by management and staff in the NHS to do that. But we're absolutely committed to this target. We think it's the right thing for patients and the right thing for the NHS.
Let's bring in our political correspondent, Tamara Cohen, who joins us from Westminster. Tamara, very good afternoon to you. There was Jeremy Hunt. You can imagine him cursing somebody at the Department of Health, whoever it was who came up with that 4-hour, 95% of admissions to A&E target in the first place, because it's a real albatross around his and his predecessors' necks.
That's right, 95% of patients are supposed to be seen within that time limit, and it's simply not happening. 85%, which is what it is now, is the lowest it's been since the Conservatives won the election in May 2015. The last time it was met was over a year and a half ago. Jeremy Hunt says meeting the target is critical to patient safety. That was his message to health professionals this morning. But for patients wondering when that's going to happen, he said potentially in the next year, by March of next year, if all the doctors and management and nurses put all their efforts into it, is what he said. Many health professionals shedding real doubt on whether it can happen even in a year's time. The government have already, as you may know, changed the way they monitor this. It used to be every week. Now it's every month in the hope of having fewer bad headlines. And the reason for it is that, of course, demand on A&E is going up. It's up 4% in these latest figures because, of course, of our ageing population and pressures on the health service, which is having to cope with spending cuts. Jeremy Hunt's message when I asked him whether he was disappointed that the Chancellor had not put any new money into the NHS was to say that he was happy that new money had gone into social care, the £2 billion over the next 3 years for the social care system. He said the NHS itself had wanted the money to go to the elderly because that would reduce the pressure on accident and emergency departments. That's also the message being sent out by the head of the NHS, Simon Stevens, today, that hospitals must respond to this by getting closer to discharging people more quickly, getting closer to that target. Jeremy Hunt has now set himself a year. It'd be interesting to see whether in a year's time he's any closer to achieving that target, and if not, whether they're going to have to scrap it altogether.
Thanks, Tamara.
Well, Sky's Becky Johnson is at the Kingsmill Hospital in Mansfield. And Becky, pretty dire reading there. NHS clearly under pressure. Waiting times in A&E increased. And what's the situation where you are?
Well, we've spent the entire morning here, and I am yet to speak to a member of staff who tells me that this last winter that they've seen a busier one. Everybody says they have never seen it so busy as the winter months that have just gone by. And they tell me it's not just the volume of the patients. To put it in perspective, normally this hospital gets around 80 ambulances a day. Over the winter, it's been closer to 100. So a lot more patients coming through the doors. They tell me the patients have been a lot sicker this winter. And of course, then what happens is the patients end up being admitted to hospital. You know, if they're very poorly, they end up staying longer, and then you get what's sort of the jargon is bed blocking, where the beds are all filled up, and then of course as more and more people come into A&E, there's just nowhere for them to go, and of course it puts huge pressure on the staff telling me, you know, they've been starting earlier, staying late, just to try and give the patients that safe care that they desperately want to do, because of course they all care about the job. The ward that I'm on now is actually called a short stay ward, and the idea is that any patient here should be discharged within around 72 hours, and that's because, especially for elderly patients, the staff tell me after around 48 hours they start to lose their independence. You know, being in a hospital bed is not good for an elderly person. Their condition can deteriorate, and it's much better for them to be back at home. And I think certainly hospitals, particularly here, looking at getting patients discharged back into the community, back to care homes. But of course, with an ageing population and a lot of ill elderly people being seen here over the winter, the care home spaces are filled up too. So, you know, a lot of issues. I think the one silver lining, as staff here say, of course these figures were for January, they have seen a slight easing of the situation in the last month, but of course, you know, beds are still full from that extremely busy period.
OK, Becky, I'm speaking to Arthur from Kingsmill Hospital. Thanks so much.